starting the recording, and Laura and Lucia, I'm going to turn it over to you.
Okay, great. Thank you, Corey. So welcome everybody. Thank you for joining us tonight and for being here. We're excited to be able to do this presentation for you and invite your questions and your comments, and want this to be something that's productive for everybody. So before we get started, I'll just do a quick introduction of myself, and then Laura will do the same. I'm a longtime Caron employee. I've been with Caron 18 years, and most of that I've actually spent working as a counselor on a couple different units across campus. And a few years ago, made the shift over to my first year, and now I'm working with people in their, as they return to their lives in recovery after treatment. So I've had the opportunity to kind of work on both sides of that, in treatment and after treatment. And this conversation, this presentation tonight is to provide everybody an opportunity just to kind of reflect on and think about some of those obstacles that come up and to normalize them, for us to be able to connect and talk about that.
Thanks, Lucia. Hi, everyone. Thank you, Corey. My name is Laura Holland. I am the program director of my first year. Similarly to Lucia, I have been at Caron almost 18 years. I was a clinician on the adult side, as well as co-facilitated the family education program, and came over to my first year almost a decade ago when we first started. So we're really excited that Corey and her team have invited us here tonight to speak with you all about our topic. And we certainly welcome your participation, both in the chat, or if you're comfortable taking yourself off mute and you want to just speak with us, that works too. So thank you all for being here.
Thank you. Okay, so as we're getting started here, wanted to just highlight some of the objectives and some of what we were hoping to accomplish with you all tonight. So as I said before, we want to just identify some of the common obstacles or the struggles that we see people encountering as they're entering early recovery. These are things that often come up for us in our work with clients and families, and so just wanting to share them and normalize that for everyone. We want to provide an opportunity to talk about available support that is there, how we cope with these struggles, and for everybody to just kind of be able to relate and share experiences. So I know oftentimes there's a lot of power and community in just being able to share experience and feel that others know what you're feeling, know what you're going through. I do hear some feedback. I know I'm seeing that on the chat here. So I think if we mute, that should probably get better. Maybe there are a couple people who aren't on mute. It sounds like that's a little bit better. Does that sound better for everybody? Okay, good. Okay, and then I will just mention. Oh, good. Yes, thank you. I'll just mention some of the wording that Laura and I will use over the course of this discussion may vary. You may hear us talk in terms of substance use disorder. You may hear us sometimes say, addiction. People relate to different terms in their recovery journey. So just know that we may use those terms interchangeably or throughout the course of this, not meant to label, but just to, sort of be inclusive as people may identify with different things, okay? If there are other objectives that aren't listed here that you feel like would be helpful, or if there's something you want us to try to touch on, welcome you to share that in the chat. Okay. All right, so we like to open it up with a question, and just to kind of get us started and to get a sense of some of the things that you all have been experiencing. If anyone is comfortable sharing in the chat, or if you want to go off mute for a second and share about it, can you identify a struggle that you've encountered in your own early recovery process? So oftentimes we think in terms of our loved one, the one who has gone through treatment, their struggles in recovery, but as family members, we experience them too. And so I just sort of open this up to what has come up for you in entering this journey. Letting go of past fears. Absolutely. Fear is such a huge part of, or dealing with fear, I should say, is such a huge part of the recovery journey for family members, learning how to cope with that. Okay, I see connecting with sober people. Absolutely. Building up that network of support, others who feel like-minded. Absolutely. Learning to trust your addict again. Absolutely. Yes. That process of rebuilding trust can be a really long and frustrating one. And one that that we're often talking about and dealing with on an ongoing basis. A lack of patience and expectations. So I think that may mean a lack of patience and a lack of expectations. Trying to come to terms with that. Denial by the addict. Absolutely. So not seeing things the same way. I see the 3 C's there. Didn't cause it, can't cure it, can't control it. Absolutely. Believing that he will get it. Okay. Unwillingness to verbalize their inner frustrations. Picking up the 800-pound phone. Yes. So asking for help. Okay. See someone saying, we as the recovering addicts coming from intense therapy and family members not having done that. Yes. So sometimes the person who's gone through treatment and their family have not received the same amount of support. And so there can be some incongruence with how they approach things. Dealing with confidence about leaving sober housing or just stepping down level of care probably, right? See, thinking things have not changed, reliving the trauma. And also the uncertainty and the wondering if things have changed. Fears of relapse and not surviving. Absolutely. Everyone's worst fear. Not continuing to enable and finding a way not to do that. Continuing to see addicted thinking. And this can go both ways, right? Both for the person that's in recovery and their loved ones. Watching the suffering and the shame and not trying to fix. Yes. Expecting too much too soon. I really appreciate everybody's chiming in and sharing these. Absolutely, these are very common feelings and experiences. I appreciate everybody being willing to jump in and share right off the bat. We will talk more about some of these things, and again, just give you all a space to share your experiences, to relate, to ask questions, and Laura and I will continue to point out some things that we encounter as we're working with clients and their families in that early recovery. Okay, thank you. Okay, so we're going to shift over to discussing in a little bit more detail some of the common obstacles that we see coming up. Okay. Just trying to get to the right slide. Laura, are you still there?
Yep. All right. Thank you.
So my slide is not coming up. Hold on. I'm not seeing my wording on this one. There we go.
There we go.
Sorry.
That's okay. Thanks, Lucia. Can everyone hear me okay?
Yes.
Good. All right. Thank you. Thank you all for sharing. I think one of the things that really creates that connection is being able to take risks and be vulnerable, and seeing all of the different answers in the chat shows that many of you can really relate to what it is that other people are sharing. And our hope is that we continue to talk over the next hour or so, that you really continue to step into that space. And if there's something specific that you really relate to or want to share, please feel free to do that. Okay. So obstacles in the early recovery process are something that many folks run into. One of the things that we'll be talking tonight is how patients and family can have really similar experiences, okay? So whether you're sitting in here as maybe an identified patient, months ago, years ago, or as a family member, you might be like, wow, that really fits in both roles. So if you're finding yourself relate to that, that can be an expected part of the process as well. So I'm going to read through these. We're just going to kind of say them one at a time, and then we can get into them in a little bit more depth. If there's anyone wants to speak about more, just put it in the chat, and Lucia or I will keep an eye on it, okay? Beginning to attend 12-step meetings. Your loved one returning to work or school. Deciding whether to tell someone your loved one is in recovery. Explaining where your loved one has been. Financial strain, asking for help, letting go of resentments, practicing patience, learning to let your loved one manage their own recovery, balancing support versus enabling, learning how to live life on life's terms, dealing with medical issues, practicing forgiveness, dealing with consequences of addiction, feeling judged or that others don't understand, practicing acceptance, seeing your loved one struggle and not knowing what the solution is, practicing gratitude, learning how to let go, learning to love myself, feelings of fear, uncertainty, and anxiety, dealing with guilt, shame, and embarrassment. That's a list, right? That's a big list, and we could all probably add more to that, right? So there are so many different obstacles that we face that some of them can be really individualized and can really feel like, am I the only person experiencing this? But then when I look back on this thread and the different answers that everyone gives, what we know, bless you, I see someone sneezing. Sorry, I didn't feel right to not say bless you. I won't say your name, but I see you. So really being able to just say out loud, like, this is hard, right? It is not easy loving someone who is in active, substance use disorder for sure. That's hard. And then early recovery and all of those changes. It's really hard and it can feel so lonely. And what's wrong with me? Am I the only one that's feeling this way? Am I the only one that's thinking these things? And what do I do with all of this? Where can I turn to? Who can I talk with about all of this? And really being able to recognize that, we're big believers that when you give something a voice, it takes the power away. Right? So really being able to reflect on how it is that you're doing as an individual. I see on here on different cameras, there's, two people or, a man and a woman, and to be able to say like our experiences may be different, right? So a common obstacle could be you have a set of parents that are responding very differently to their child in the early recovery process. You could have a brother and a sister responding very differently to a parent, a loved one, whatever that looks like, right? And I think it's so important to be able to acknowledge that and recognize it, because sometimes we think that other people are experiencing the same thing that we are, or that they should have the same boundaries that we have. If I'm mad about it, like, aren't you mad too? Like, well, you should be mad. You should be sad. Like, we start to should on people, right? So really being able to recognize that my experience might not be the same as even someone who's under the same roof as I am. We could have 5 people love the same patient and do it differently, okay? So when we look at these different common obstacles that we run into, beginning to attend 12-step meetings, we can do a show of hands, or maybe you can put it up in the chat, but that can be a really hard one for family members. Why do I have to go to a meeting? If they would just stop, fill in the blank, like everything would be okay, right? So there could be some resentment for family members of, I don't have time to do that. I've worked all day, and we can come up with all of these excuses or reasons or justify our behavior as to I shouldn't have to do that. If Lucia would just stop drinking, everything else in our home would be okay. And what we learn is that it doesn't always work that way, right? We believe that addiction, substance use disorder, whatever language you're comfortable with, that it is a family disease, and that you can't love someone with this disease without being impacted. That may vary. For some people, it might feel like a 0. I mean, yeah, they use, but whatever, that's on them. And for some people, it might feel like a 10, like, I don't even know who I am. This thing has like eaten me up. Al-Anon in many flavors has been a godsend. Thank you, Mariah. So really being able to take a look and really slow down and say, you know what, I have to practice self-care. Where do I start? So really taking a look at the idea of 12-step meetings. When I worked in the family program, one of the things that really stood out to me, I had a wife one day, and you know, different slogans and acronyms are certainly in all of the rooms if you go, and if you stay long enough, you'll get to know them. But really the idea of, I went to Al-Anon for my husband, but I stayed for me. Right? So someone else may be that external motivation as to why you start doing something. But then as you stay in it and you stick with it, it's like, wow, this is really helpful. Right? And what I love about this one is that your patient, your loved one, could probably connect with you on this one.
Mm-hmm.
Hey, it feels really awkward. What do you do? Who do you sit with? Do you share? Do you say anything? Right? So very often, Lucia and I will say to our family members, talk to your loved one about meetings. You know, what gets in the way of you wanting to go to a meeting? What are those reasons that you're saying? And I often challenge the folks that I'm working with, and I say, if your patient gave you those reasons, would that be okay? I'm tired. I don't want to go. Right? Or would we really want them to do it? Let's see what we have here. Mm-hmm. I've been in recovery for 10 years, but this last stint at Caron Renaissance back in April was a 3rd relapse. My husband of 9 years felt so hopeless that he turned to Al-Anon. He tried before, but was discouraged by some of the meetings. He needed to keep trying other meetings, and online helped ease into it. Now he has a sponsor, goes 3 times a week. It works, but there has to be a gift of desperation. That gave me goosebumps. Thank you. Yeah. Amen. So hard to go to those first few meetings, but so grateful for the recovery. Al-Anon and ACA are essential to families in recovery. I concur. My son appreciates me going to Al-Anon. He often asks me, what meeting are you attending tonight? I love that. So there's that family piece that we talked about, right? Mm-hmm. And it's so true, that gift of desperation, right? Really being able to, like, how, when it hurts enough, something will change. Mm-hmm. And unfortunately, as individuals, our pain tolerances are very different, right? What could be a lot for me might not be a lot for you or your loved one, or vice versa. Mm-hmm. Sorry, I'm just reading these. And I think really being able to recognize, again, like that parallel process, and we're going to get into that a little bit later, but really being able to recognize that I can go to this 12-step meeting and I can have people who really understand what it is that I'm talking about, right? So I would often have people say, I have really good friends. I don't need to go to Al-Anon. Like, everyone who needs to know knows. So I've got my best friend, I've got my neighbor, I've got my church group, I've got my workout girls, like, I'm good. Because what people hear is support in that, right? Now, I don't know about the rest of you, but some of my friends sure will co-sign some stuff if they think that it'll help me feel better, right? Mm-hmm. Like, he did what? He said what? So what's really nice about Al-Anon is they don't really care about what the person, right? Because they don't know them. So it really becomes an opportunity for somebody to just give you some support. They're not emotionally invested, right? So that's not to say that people in Al-Anon don't care about you or don't want what's best for you or anything like that, but there's not the same emotional investment that your mom might have, your best friend might have, right? So really being able to separate the person from the disease, from substance use disorder. And that's one of the things that's really offered and available when you get around like-minded people that understand what's going on. Okay. Oh, look, Kate, I'm about to put you on host. Exactly. Al-Anon reminds me to separate this disease from my loving heart from my addict, right? That can be so hard to do because it shy of active addiction, like it's all rolled into one, right? And I think if you're really able to look at your loved one, right? So if everyone just kind of takes a minute and they think of their loved one, maybe it's your daughter, maybe it's your best friend, your significant other, husband, wife, son, your mom, your dad, and you really think about them as an individual. Maybe they're really funny or they're kind. There's things that you love doing with them. And then on this other side is active addiction, right? And how does active addiction try to rob that person from you? That your loved one is a sick person trying to get well, not a bad person trying to get good, right? And really being able to have boundaries with this disease, right? I will support your recovery. I will not enable your disease. Mm-hmm. Accusation of codependency versus what we're taught. Caron, if you're comfortable, are you able to say a little bit more on that?
Shall I speak?
Sure, if you're comfortable.
It'll be much quicker. It's just basically that being a nurse from years ago, though, so I have that little bit of a medical perspective on things, not at all scholarly in addiction, but when I want to suggest, say, a book that was referred to me by a reputable source that Caron perhaps recommended to me, someone of that line. Eventually, his elderly or older parents either don't respond or they feel that I'm giving my spouse too much attention or attention, basically, and that this is his ordeal for the most part and not to cater to him. So it's reading to me quite a fine line of how much they really want to know sometimes. Right? So I don't know how to tread often.
Okay. Thank you for sharing that. I appreciate it. So especially I would add being in the helping profession, right? Helping profession, parents, it's really counterintuitive for anyone to watch someone you love struggle because you want to help, right? What we find, though, is that the concept of powerlessness applies to us as family members the same way it does as the patient. So I think one of the things that I would suggest is kind of like asking, right? So I have some resources. If you would like them, I can share them with you. And then also being willing to take a look at what is driving this behavior in me, right? What is it about for me right now? Am I scared? Am I worried? Do I want to fix this? And again, especially, helping professions, it's just in us to want to take care of something. And sometimes our patients don't want that, right? And it can even drive a little bit more of a wedge, like stop trying to fix me. And it's like, well, I don't know what you need. And you seem like exactly, whose discomfort am I solving, right? So how do I sit with you in this? And that's where the concept of boundaries comes into place. You know what? It's not good for me to watch you do this, to watch how addiction, substance use disorder has taken over. So I need to put some boundaries in place. But I think asking the question, checking your motives are all really good things to just kind of help ground and like figure out, why am I doing what I'm doing right now? Some other ones that we have on this list. And again, if any specific one stands out, please let me know. Deciding whether to tell someone your loved one is in recovery. That can be a hard one to manage as well, right? Because it's your loved one's story to tell. However, there may be times where people are asking, well, where are they? Where is she? I haven't seen them in a while. Again, sometimes as we get into whether it be holidays or sunny weather, or whether it's barbecues, cookouts, like whatever that is, just social events. Do I tell everybody that they're not drinking or they don't drink anymore? So again, really just being able to have a conversation with your loved one as to like, how do we navigate this? We're going to this place that historically you would drink at. Like, what is the plan here? And really being able to have that conversation and have those boundaries as the family member, being able to redirect those people to your loved one. You know, that's a great question for Lucia. Maybe you should ask her. I really appreciate your concern, and I'd like to give Lucia the opportunity to share that with you herself. Right? Mm-hmm. Asking for help, financial strain. There's a financial cost to addiction, right? And sometimes that can take years to recover from. So whether it's just use of substance, whether it's jail, court fees, even treatment itself can be very expensive, right? Now, obviously that would aid in recovery, but there's a lot of financial loss of job, all different types of financial aspects to this that could really take time to recover from. My husband respected my story, but decided to tell our closest family and friends because part of it is actually his story, and he needed his support while I was away and in sober living for a few months. We just needed to communicate and sync our stories. I like that. Who said that? Jason. Mm-hmm. So I like that because my takeaway from that is that last sentence. We just needed to communicate and sync our stories. So I would say when I facilitated the family education program, I'm not expecting anyone to put an ad in the local paper as to where you've just been and all of the details. You get to decide how much you want to share, right? So if Lucia and I make an agreement that she gets to tell, her people or whatever that is, like, hey, look, Laura no longer drinks, or like Laura got addicted to pain pills. So there's that agreement, right? We have in our relationship developed boundaries of what that disclosure looks like. If Lucia needs to process more and heal more, and sometimes part of that is disclosing events that have happened in the relationship. But maybe I do that in a counseling session, or we do that in a therapy session together, or in a professional setting of some sort. So it doesn't just feel, so again, that motive, that intent, I'm not just airing all of our dirty laundry out there for everyone to see. I'm sharing this for the purpose of healing with professionals, right? So I love that last sentence. Mm-hmm. Practicing acceptance, really being able to get to a place where you're able to kind of move on and to take a look at, this is where we are, this is what has happened. Again, I just to keep referencing it just because it's such a great program. We have the family education program. If you've not been to it, I certainly encourage you to seek out a way to get there. But so much of this is relative, and we would say you can't go past 6 months back, right? So we're not going to sit here and say, well, 5 years ago, this is what you did, or 10 years ago or 3 years ago. So really getting to a place where you are able to move forward. How do you learn to let go? Learn to love yourself, right? So a lot of these things all kind of like just jumble up together. And, if you kind of like work on one, then you get to the next one. Sometimes people use the analogy of, layering those peels off that onion peels and peeling back those layers. So really being able to take a look at all of this. Gratitude. Gratitude can be really hard to find, of like, what could I possibly be grateful for? Look at my life right now. And really having to dig deep and really do some like work on that. What am I grateful for? What are the yets that we did not experience as a family or as an individual? So being able to take a look at all of those. Practicing forgiveness, that can be a really hard one, right? When you take a look at kind of like the tornado of substance use that can rip through your life. some of the stuff that requires forgiveness could be really hard to do. And that's where having your own support system is going to be really, really important. And again, just I kind of keep saying it, but allowing yourself to heal from the pain that active addiction or substance use causes. Oh, you got a storm going on. Thanks, Corey. Dealing with guilt, shame, and embarrassment, that can be a hard one as well. What do you say? Sometimes, addiction, it doesn't discriminate, right? So sometimes things can happen in public. And, addiction loves secrecy. It loves to isolate. Addiction and active substance use disorder loves all of those things. And it's not always contained to like private matters or people. So sometimes there's, we talk about collateral damage that happens with active addiction. So there may be a time or two where loved ones, family members see something that otherwise you wish they wouldn't have, right? So having to heal from that and maybe have conversations or going through a process that's painful or difficult. And again, many of the things that are listed on here, your patient, your loved one, if you are the patient, or the identified patient, can all relate to as well, right? We can probably move on from this, Lucia, unless there's any that you would like to chat about.
No, we can move on then. Let's see.
So the parallel process is a phrase that I had just been using, and we often use it, right? So if you look at the idea of like parallel, like train tracks, what goes on with the patient and what goes on with the family, those can very often run next to each other. And again, I think there can be connection in those moments. Language like, I'm feeling triggered. A patient has their trigger, right? And that's obvious, right? Oh, they were triggered. But as family members, like, what does that mean? Like, I could be triggered. So I'll just read it here just so everyone can hear it. Triggers: just as your loved one can experience triggers to use substances or engage in an unhealthy behavior, family members and loved ones can be emotionally triggered. Emotional triggers can occur. Oops, my screen's in the way. Emotional triggers can occur when you see your loved one displaying behaviors that remind you of when they were using, drinking, or acting out. So if you think of your loved one when they were in active substance use disorder and some of the behaviors that you saw, and then if they're in recovery now, some behaviors could still happen, but could cause a visceral reaction in you. So I'm just going to throw some out, and if any of these relate or they kind of talk to you, feel free to comment or unmute. Sleeping in. So they're not getting up at normal time. Taking a nap on the couch. They're late to a family gathering. They don't answer your phone call. I'll say that one again. They don't answer your phone call. That can spin some family members into a complete tizzy. Like, why didn't they answer? What are they doing? Where are they? Lying about their whereabouts. And sometimes that can even in recovery, that can happen. Like, so if you think about all of like the old behaviors that are being undone, and the idea of like, well, I didn't want to say what I was doing, right? Because I didn't know if you'd be mad about it. So even working some of those things out in the early recovery process. Wanting to come back home for the holidays. We often use the phrase old people, old places, and old things. So for when a patient would say, well, I want to go hang out with so-and-so, or I want to go to this place, or I want to do these things. Even if you think like some people love to, golf, and maybe golfing and active addiction was something that they would always do. They go back to the clubhouse, have drinks. Now that they want to do that sober, with the best of intentions to be sober and to do it in a healthy way. But as a loved one, that could be a really triggering experience. Happens to me all the time, even 4 years later, how to manage and stop. Thank you for sharing that, Anne. So I think part of it is really being able to talk about what is going on with me, right? So being able to say to your loved one, when you, and fill in the blank, I feel, right? So really being able to communicate with your loved one what comes up for you when they engage in a specific behavior. And I think a lot of this, is going to come back to that communication, and really depending on communications to allow yourself to navigate this process together and to cope with the different obstacles that come up in this process. Okay. Lucia, I have potential emotional triggers.
Yes. Okay. Are you ready to move on from this one?
You're welcome, Anne. Yes, I'd say so, unless anyone has any specific questions. I offer to have my, oh, that's a good one. That was on the obstacle. How can I not? Who said that? Thank you, Jason. I offer to have my phone location services on my phone, even though it wasn't asked of me. I also asked my therapist to authorize random drug testing breathalyzers for now. It is accountability for me and peace of mind for me. I know the damage I have done. So I thank you for sharing all of that. And I think this is a really good opportunity, Jason, to remind you of what we've been talking about, right? Which is really separating addiction, substance use disorder, and the patient, right? So I know the damage this disease has done. I know the damage my use has done, right? And we've got to start there with that. Because we have to undo all of that. That language keeps us in shame. And it's really hard to heal when we're stuck in shame. Whereas guilt, we can heal from and move through, right? So really just being able to do that. And I think part of it is, I love that you have the therapist doing that. I think Lucia will talk a little bit more about this later, but as family members, we want to have all the things and just have control of all of that. So I do appreciate how you have your therapist part of that. And also recognizing look, I have work to do, right? For some of you, you're not going to believe anything your loved one or your patient says. You've been there, you've done that, and you have got the t-shirt. So go ahead and tell me how this time's different. And you know what you need to do, you just need to do it, right? You need to see behavioral change for that buy-in to come from you and to take a risk as a family member to be vulnerable, right? So all of this, these emotional triggers and such. So I'll turn it over to you, Lucia.
Okay. Yes. Thank you. And I think maybe just what I would sort of identify as a common theme as we look at some of these emotional triggers, and I know that there are others, is that, it can be hard to watch your loved one struggling. And there can be so much uncertainty about, at what point am I being supportive, and then when am I going too far? How involved do I get? And it can be hard to watch and to allow them to take responsibility for their own recovery. And Jason, I do appreciate what you shared in terms of willingness to have transparency to rebuild that trust. Thank you. Okay. So when these emotional triggers happen, we may see ourselves behave in different ways. Sometimes we may present as controlling. It may be that I'm triggered, I'm fearful, I'm anxious. And so oftentimes I think our human reaction is that if we see an issue, we want to just kind of descend on it and try to solve it, get as much information as possible so that we can feel reassured that perhaps things are okay. Exactly what I was referring to. Oh, thank you, Caron. So oftentimes we'll see those controlling behaviors as, as a way to help quell our anxiety, or maybe if we feel as though our loved one is kind of getting off track, to try to, get them back on the path again. Sometimes we can feel like we just go right back into anger again. And anger and fear, as I'm sure we all know, are often very closely connected to each other. especially if we see things start to get better, right? We see improvements start to happen, changes are happening, we're on a good path. And if we see a behavior, we see something that concerns us, it can really elicit that response of like, no, I don't want to go back to that. And that anger can come up. Some of us cope by pulling away, withdrawing, or emotionally detaching. Because engaging in these cycles can be really painful and difficult. Sometimes we just cope by kind of taking ourselves out or kind of checking out emotionally, not really connected. The opposite of controlling is just sort of like pulling back. We may feel sad or nervous. Again, just, the fear of things going back to as they were beforehand, not really knowing what to do with that, feeling sort of hopeless or uncertain, can really bring up those negative emotions. We may feel as though we're overbearing. Again, fact checking, asking lots of questions, asking our family member to maybe explain things multiple times, to verify, to ask other people. They said they were here. Did you see them? Just really trying to get as much information or control the situation. Or family members may say that they feel as though we're judgmental or critical of them. Again, that we're maybe, we may have something to say about the way that they're going about their recovery. It may lead to arguments or conflict, but these are the ways that we can see, that we can sometimes see ourselves react in the midst of a trigger. I don't know if anybody wants to kind of share anything or give an example in terms of these reactions that they can relate to before we move on. We'll give a moment here.
I'll just say real quick how easy it is, even though we know better, how easy it is to slip back into our own, why we need Al-Anon, basically. And I'm I'm at the top of the list, and I can learn and relearn something and feel confident walking across the street. And before I know it, I'm back slipping again. So it does empower your empathy for the person who's dealing with the actual substance abuse.
Mm-hmm.
Thankfully,
Absolutely.
something, good.
Yes, absolutely. And thank you for saying that. I think that perspective is so helpful in, whereas as Laura said, addiction or substance use can be so divisive. It can put up a barrier between us and the people that we love. Having empathy that you're both going through the same struggle, but in different ways, helps us to look at the situation as we're in this together. We're both experiencing this just in different ways. Yes, thank you for sharing that. Okay, so I'm looking here. Can we talk more specifically about controlling versus detachment versus denial? It is very confusing. I don't want to control, but I also don't want to slip into denial. It's a fine line. And it is, and yes, I agree. It is easy to fall back into. I will slide back to the question about controlling versus detachment versus denial. But I do just want to kind of highlight one last point about that is again, that parallel process of that we are continuously working on ourselves, taking care of ourselves, thinking about our own recoveries, because we can go back even when we know better, right? And that we just have to continue to stay vigilant and keep doing the work that works for us. So the question of controlling versus detaching versus denial, it is a tricky one. And I think it's really difficult to concretely define all of those. This one can also be different for different family members. And, I will certainly open this up to others' thoughts on it. But oftentimes I think that it's helpful, as we talked about before, to have your specific family system be communicating about what you need from each other in terms of support. But whereas where maybe it's going too far into enabling, or maybe your loved one feels as though you're kind of stepping back too much and you're not interested, we will sometimes find ourselves talking with clients and their loved ones about how can your family member show you that they're interested in your recovery, that they want to understand what's going on for you, that they want to know your point of view without it feeling as though they're being invasive or they're questioning you, right? So oftentimes I think we need to keep lines of communication open so that you can understand for your family member who's in recovery, like what comes off as controlling for them versus what do they feel is the appropriate amount of support, what feels like you're detaching too much and stepping back. And that may change from situation to situation or for different family systems. I was seeing Kate saying all the lying makes it hard to stay in the present, which is true. You know, we know that there's a history that brought us here. There have been behaviors that brought us here, and it can be hard to let go of them and focus on what's happening right now in the present and not bring in the questions of what happened in the past. I'm seeing Anissa saying, yes, it must be hard for them as it is for us to fall back into old habits. And yes, that's true. And we have to be gentle with ourselves, with everybody. We are often sharing both with our clients and their family members. Recovery is not a linear process, right? We don't just go from point A to point B. We will take steps forwards. We will take steps back. You know, it will not be a smooth, easy process. And it's okay to have a step back because oftentimes we can learn from that and we can change. I do want to ask, Laura, I don't know if you want to weigh in on the idea of, the balance of controlling, detachment, that sort of thing, or if anybody else has thoughts on that, because I think that's something that really comes up a lot that many may experience.
Mm-hmm. Yeah, certainly. I see some more people are commenting. Is it possible to have there are different stages. There's different stages of recovery in general, it's just where people are at. Are they thinking about it? Do they want to do it? Are they willing to move into action, maintenance? So there are actual stages of recovery that we could probably do a whole nother presentation on. But there certainly are that our folks are in, but I'm scrolling back up here quick to what Lisa wrote. Mm-hmm. There's detachment, and there's what does that look like, right? So some of you, if you're familiar with Al-Anon or the process, you hear the phrase detach with love, right? I can love you from afar, or am I detaching with anger? I don't care what you do. I'm so annoyed right now. Or is it look, I really love you and I care about you. And it's really hard for me to just watch you continue to make choices that aren't necessarily healthy or in support of our overall goal of, wellness or whatever that looks like. I think what came up for me as I was listening to Lucia and I was just kind of reading some of these is that what is decided in early recovery, and this may tie into who asked that question about the stages of recovery, maybe for Mimi Carter. It's not always, right? So sometimes when patients are in treatment or, family groups or whatever that looks like, early recovery, it's so I'm never allowed to do this again. We're going to always have to do this. And it's no. Let's pull it back. Maybe what the commitment is for the first 30 days at home, I won't go to this place where I used to always go. Or, I don't know, we won't hang out with those people or do those things. Or I agree that for the first 6 months, or, for the first 60 days or 90 days, this is what I'm willing to do. I think one of the examples that comes out is we often talk about, 90 meetings in 90 days. And it's I have to go to a meeting every day for the rest of my life. So if we look at that as the example, right? And really being able to take a look at what is my motive around this? Controlling, detachment, denial. I want to validate and recognize it as family members. It can be really, my voice is not clear. Can you guys hear me okay? Maybe if I talk louder, is that better?
It just it sort of sounded like it was in a funnel for a moment.
Is this any better? No. I think it's a microphone issue.
Yeah, it seems to be.
I'm not sure. Is this any better?
We can still hear you. It's just
I
wasn't as
apologize.
clear.
Let me hit mute and unmute and see if any better.
It's about the same from where.
All right.
Yeah, so we can still hear.
Can you tolerate listening to me for whatever is going on right now? I think part of it is really a family member really being able to recognize and validate that there are times where what you saw happening and like you challenge that or you questioned it or your gut said something's off, right? But with the way this disease works, there's a really good likelihood that you may have been manipulated into believing that like that's not possible or that didn't happen or right. So denial can be really hard to navigate because, and when I think of denial, don't even know I am lying, right? So just not trusting your gut. And I think that that's something that when you love someone who's in active use, that can very often happen. And really being able to navigate that and what's going on. And if I say something, am I controlling? If I don't say anything, then I don't care. So to Lucia's point, like this is always moving and really being able to find the shade of gray with that. And really, again, I go back to communication. Like what is helpful? How will you best hear my feedback? Because if I ask something or I say something, I'm nagging, I'm controlling. If I don't say anything, oh my gosh, you don't even care. So again, we often talk about finding that shade of gray and hoping that that is something that through conversation and experience. And again, what also is really important is like, some people call it spiritual wellness, being spiritually fit. So when I'm taking care of myself, am I then more focused and kind of staying in my own lane? And then it's not as easy for me to take on other people's stuff. And if I'm not anxious, am I therefore allowing my loved one more room and space to maybe make a healthy choice? Whereas if I'm really anxious, am I saying, nope, we're not doing this. You can't do that. You can't go there. What were you thinking? And it's a lot of this. Whereas if I'm feeling more grounded and healthier in my position, does that leave space for communication and dialogue instead, right? But really being able to, Lucia used the word fear earlier, really being able to learn to relearn to trust your gut, right? And again, that is a fine line of, were they just late? So being able to tell on yourself, when you don't answer when I call you, I feel really anxious. When you're late to dinner, that's really triggering to me. So I'm a big believer that when you share those triggers with your loved one, and that's vice versa, right? It really just opens up a whole world of dialogue and understanding that otherwise wouldn't exist.
Absolutely. Thank you. Okay, so some of these we talked about a little bit, but again, some of the ways that we may look to kind of calm those emotions or calm those fears are some of these unhealthier coping skills. So we talk about the idea of the family facilitating monitoring. So giving on-demand drug tests or saying like, blow into a breathalyzer when you get home. And we really discourage family members and loved ones from being in that role because it puts you in the role of, enforcer, policing, whatever the case is. And it makes it much more difficult to stay in the role that you are in, mother, father, spouse, sibling. It puts the burden of, of responsibility of kind of getting down to the truth. And we really encourage our clients and their loved ones to be utilizing their aftercare support to be in that role so that your focus can be on, being a parent, being a spouse, being a significant other, their friend, their sibling, whatever the case may be. rather than trying to verify sobriety or that they're on the right track. I know what GPS tracking was mentioned before. So again, oftentimes family members may find themselves like, if I can just verify, and I think coming from a good place of like, I want to rebuild trust. I want to know that the person I love is doing what they say they're doing. And so if I can just check in every so often and just make sure that they are where they say they are, then I can feel some reassurance that we're getting somewhere, we're on the right track. Let's see, I see we're asking, does this differ for minors? Our daughter is 17 and a half. And sometimes I think that can be a bit different. When we have younger children, curfew rules, those sorts of things that are in place, that one can be a little bit different. I do think though that tracking and those kinds of verifications can be sort of a slippery slope, because I've seen a lot of family members find themselves kind of obsessing or perseverating on it. I was actually working through a situation with some parents that I'm working with recently where checking their son's location, seeing that he was further out from where they had anticipated or had an expectation for him to be, really brought up some pretty significant emotional triggers for them. And it kind of spiraled into fears about relapse and other behaviors that may be going on. And so, while I think it can provide some verification that my loved one is doing what they said they're going to do, it also can be something where we become more and more reliant on double checking, or people can falsify their whereabouts in different ways. And it can be counterintuitive. I know it says following a loved one here. Sometimes that has happened too. Again, like just trying to verify, are they doing what they say they're going to do? Are they following through? I'm going to put myself out there and make sure. And it is really difficult when your loved one is younger, when they're a minor or a teenager, to sort of walk that line. Sometimes we'll see family members who say like, I'm going to go to the meetings with you. And that way, again, I'll know that you went. I'll see what's going on there. I'll have a sense of what your recovery looks like. I'll make sure you're staying the whole time. I'll make sure you're not going somewhere else. And while that fear and that concern is understandable, it also doesn't provide an opportunity for trust. I see someone's asking, is insistence on naltrexone unhealthy? We are very big supporters of naltrexone. It is a great tool in the toolbox in terms of support for recovery. We find that it really helps in a lot of ways. I think the struggle is the insistence part. I think I would want there to be an agreement around the use of a medication moving forward. And I know that can be difficult when you may have a different idea of what's going to be most effective or most helpful for sobriety, and your loved one feels differently. But I think we can get into a power struggle if someone feels forced into taking something that they don't want to take. And I worry about if there would be compliance if they were completely resistant to it. I do think that's a really important thing to talk about and to have a dialogue around, to identify why you feel like it would be helpful. And it can be part of some of the boundaries that you outline as you're making decisions about moving forward. All right, I'm going to see here. Looking, maybe this question is a bit too patient specific. So your 22-year-old attended 3 months inpatient treatment. She's about to complete 6 months in sober living in Florida. She doesn't want to continue staying in sober living, instead rent a regular apartment alone. This is her first treatment, her first recovery process. My husband and I are afraid she won't be able to sustain her sobriety for a full year living on her own. How important is it to stay in a sober facility type of living for at least a year? Okay. This is a specific question, but I can touch on it a little bit. Obviously, your treatment professionals are going to suggest as much support and as intensive of support for as long as possible, because it really does give the individual time to establish connections in recovery, build up their coping skills, be able to deal with the struggles that come up that are inevitable. And staying in a sober living environment is a really, really great way to do that, for a person to learn how to rebuild their life in recovery, and live a life sober without a lot of potentially those outside influences that can be triggering or could maybe lead them back to using. So I think the specifics of kind of navigating this situation with your daughter would be important to really talk through with her treatment team, and I'm sure you're doing that. But I think if ultimately the decision or where things land is that she doesn't stay in sober living past these 6 months that she's been there, that you talk about how does she layer support in place for herself? How will she make sure that she has enough support or she has what she needs when she's not living with other people who are also working an active recovery program? What are some of the risks, or what are some of the struggles that she may be up against if she's living by herself? Can she effectively ask for what she needs on a ongoing basis, and just to kind of talk through and troubleshoot some of the things that may come up if she isn't in a residential environment anymore. But thank you for asking that. I know these are some of the really difficult questions that we're faced with of, how hard of a line do we hold, right? Versus do we allow them some space to make some choices? And I think that we can have a really honest conversation about like what your fears are. And if living on your own is not enough, then what's our backup plan, right? And that we can kind of have that established while she's still in a supportive environment. All right, Anne said, daughter left sober living early against all recommendations, and it was scary. You didn't support her financially during this time, and it was tough for her, but she earned a lot, and she's now in college and on the right track. All journeys are different. It's true. Absolutely. Thank you for sharing that. And, I always, as I said, just to kind of, to close this loop, I'm always an advocate of trying to plan as best you can. When someone's in a secure environment, when we're not in crisis, that we could really talk through what our concerns are, what might we be up against, how can we make sure that we have, you have support layered in place, you have what you need. And if we start to feel like this isn't enough, if you're struggling, how do we pivot and make sure that you have what you need? Okay. Mariah is saying, not doing things you would normally do to stay home. This is me. My husband and I have taken separate visits to friends, so our son is not home alone. It's not going well with my husband. Yes. Yes. So I know I didn't quite get to that one yet, but oftentimes, again, in hopes of wanting to make sure everything is okay, in hopes of wanting to keep an eye on things and be very vigilant, we may, we may not engage in things that are important to us, or practice self-care, or spend time with people that we want to spend time with because we want to keep an eye on our loved one. And again, that can be counterintuitive or ineffective, because we do need to be taking care of ourselves in order to go through this journey in the best way possible. Thank you. And the one other thing I will just mention is, as it says here, so oftentimes we may set boundaries and not maintain them, or be afraid to set them at all. And I know I talked about fear in the beginning, and oftentimes I think what we find around the struggle with boundaries is that it is very fear driven. That we can be afraid, like, if I set this boundary or if I have this limit, what will happen? How will they respond to that? Will it somehow push them to make an unhealthy choice? Will I be responsible for that? Or maintaining the boundary that you set, being so uncomfortable that it can really, really be difficult to maintain. Absolutely. Okay. Okay, Anne's saying learned a lot and did not earn much. Okay, you're saying that your daughter, it was tough for her, but she learned a lot. Okay, and now she's in college and on the right track. Thank you. Okay. Laura, anything you want to add to this one before we move on to the next?
No, I think this was a good discussion, and I appreciate everyone commenting. So I think that was good.
We just have one more. We're going to look at the flip side of things.
All right. So let me just move my slide. I hope you guys can hear me okay.
You sound better now.
Okay, good. Thank you.
Thank you.
All right. Oops. Okay, so I think one of the things that I just want to highlight is, if you notice, Lucia and I are not using language like, what's a really good thing to do? What are the bad things? So really being able to recognize like healthy versus unhealthy. The way that I look at it as well is, if I'm standing in the middle of the room, the left side is unhealthy coping skills, the right side is healthy coping skills, and I'm about to say or do something, like, which way am I moving, right? So am I moving towards unhealthy, or am I moving towards healthy? And I think really being able to slow yourself down enough in these moments to recognize and to have enough self-awareness of like, probably shouldn't have said that. Won't do that again, right? And then learning from that. You know, there's no book to all of this. I mean, sure, there's the big book, there's Al-Anon, there's millions of self-help books. And like, sometimes you just learn it when you're in it, right? So Lucia used the phrase being gentle with yourself. We say that a lot because it's so important to be gentle with yourself in this process. Some things that may seem so obvious to others, when you're in it, it's like, oh gosh, I don't even know which end is up right now. So I just want to wanted to acknowledge that and spend a little brief time or minute on that, because I think it's so important that you don't know what you don't know, and some of this stuff you don't know until you're in it. Right. So a healthy, and if you have ones that are not on this list, feel free to add them in the chat. I think if we can share more healthy coping skills, that's good for others to see as well. So having your own support system, we talked about this earlier, and I would also say autonomy, right? So really, truly having your own support system, that it's okay to still have mutual friends or, mutual family members, gatherings, things that you go to, but sometimes families will be like, well, I'm going to call their sponsor, and I'm going to tell their sponsor, I'm going to ask their sponsor. And it's like, we would never, want you to do that unless it's like literally a life or death situation. But having your own support, who do you go to? Right. And even again, if you're on here as a husband and wife, or spouses, parents, sisters, you might have different people, right? We respond to things differently. Sometimes we stay really intellectual, and that's where we best operate out of, like our head space. And then we can operate out of our heart space and be really emotional. So sometimes we can look at someone who's in this with us and are like, how do you not care right now? Or why isn't this as big of a deal to you? And the other person might be like, you're really overreacting, but it's just, we're different. So having your own support system. I even say that again, just to reiterate, in the family system, I've had parents that they're like, well, he or she doesn't want to go to a parent support group with me, or he doesn't want to go, or she doesn't want to go, or so go by yourself, right? Maybe your loved one doesn't feel the need to go, but you as the individual, maybe you really need it. So there can always be different issues and different things that we're looking to heal, and it's important to allow yourself to step into that space, regardless of what other family members are doing. Okay. Attending support groups such as Al-Anon, Nar-Anon, ACOA, parent or spouse support groups. So Al-Anon would be just in case people aren't familiar with the language, typically that's for if your loved one's an alcoholic. Nar-non would be narcotics. ACOA is adult children of alcoholics. So perhaps you grew up in a home with substance use disorder with either of your parents. Then we have parent or spouse support groups. You know, there's common threads and themes and a lot of similar things that happen. However, dealing with your children in this process versus saying dealing with your 50-year-old brother, it's just a different set of circumstances. It doesn't make one more painful or less painful than the other. It's just different. If it's your spouse or your significant other versus a child, you may find yourself in a position where it's much easier to set boundaries with your spouse or loved one than it is your 17-year-old daughter, right? So really, when you're around people that, again, are not only like-minded, but really specifically like-minded, you can bounce ideas off of each other, get support. One of the nice things about support groups is that you can have dialogue. So oftentimes, if you are in the rooms of 12 steps, there's not a lot of feedback or quote unquote crosstalk. So sometimes people can, like, family members can leave with like, I didn't get any answers. And it's kind of set up that way on purpose. But if you get into a support group, I know Caron offers a lot of them and different kinds of groups and such, that you're with people who have similar experiences and that you can connect with in a more like conversation and experience, and maybe being able to ask those direct questions. Therapy, whether that be individual, couples, or family, some of these can be really hard to acknowledge that they're needed. Because again, kind of like where we started off, there's this idea that if the substance would just be put down, everything else should be okay, right? And what we know and what people learn is that that's not always the case, because healing needs to happen from the experiences that occurred while in active addiction. Or if there's different thoughts, behaviors, belief systems that could run for like generations back, right? Family of origin stuff. Like, you put the chemical down, everything is still there. And it's like, so what do we do with all of this? And very often, and we see this with couples, the last time that people may have been around each other sober or without a chemical in their relationship could be decades for some people. It's just always been. Mm-hmm. So being able to have intimate conversation, intimacy, right? Like allowing people to see you, allowing your relationship to have space for vulnerability, transparency, communication. When there's not a chemical present, that can be really hard to do. And learning how to communicate and all of those things. So when you're in a place where you're going to the meetings and you're going to the support group and you're doing all of these things and you feel like, I feel like we're still stuck, that could be a time where you maybe introduce professionals. It's always good to start there too. It doesn't hurt. But if you find yourself this like reoccurring theme or pattern with your loved one, it could be a good opportunity to do that. When my husband got rid of his substance but wasn't in recovery, he just got sicker. Mm-hmm. So, and we often hear of this idea of like white knuckling, a dry drunk, quote unquote, right? So again, all of that stuff is still there, and really taking time to allow yourself to take a look at all of that, because it doesn't go away. Everywhere you go, there you are, right? So thank you for sharing that, Kate. I remember asking someone, like, what do you do for self-care? And, in this field, that's such a common phrase. Like, tell me, like, what do you do for self-care? And they were like, what does that even mean? I go to work, I don't know. And it's hard to really think about, like, if you stop, what is self-care? What is something that you do literally just for you that brings you joy, right? That allows healing. Sometimes it's really hard. Well, I do this with my kids, or I do that. And it's like, no, what's something really like for me that allows me time to heal? And that comes in many different forms for people. And what may be self-care for me might not be self-care for someone else. But some examples are yoga, exercise, and again, just doing things that you enjoy. This disease, substance use disorder, active addiction, it robs families of joy, whether it's the family system, whether it's a specific individual. It doesn't want joy to be a part of anything. So getting back to that and allowing yourself to do things for you can also feel really selfish, right? So much time and energy can go into dealing with active addiction that oftentimes people lose themselves. Like, I don't even know what I like to do anymore. I can't tell you the last time I fill in the blank, right? Because so much attention and focus goes on this. So really getting back to some of those things in your daily schedule. Spending time with supportive friends or family, I think that just speaks for itself, right? Like being around people that feel good, and even getting back to those relationships. When I think of this disease, it can really be isolating. And, you know, maybe you don't have the energy, or you don't want to, or I just don't feel like having to ask the questions. So you've been saying no to doing things or going places. So getting back to some of those things. Open and honest communication with loved ones. You guys have heard the word communication many times over this last hour, and it is just so important, because this disease, really any dysfunction, can really come up with like rigid rules and expectations and such. And one that can happen is like, let's sweep it under the rug. We're not going to talk about it. Walking on eggshells. Don't want to upset this at all, so I'm just not going to say anything. And if we look at the counterintuitive part of that, as far as recovery goes, that's giving a voice to things. It's saying things out loud. It's pointing things out. So really having open and honest communication and being able to say how you feel about something, being able to share if you have a concern, having shared activities such as weekly meals together. Just having time. We had patients and family members, like if they do pizza and game night, right? Or maybe they go on walks together. Or I remember one, they would do like bagels on donuts on a Saturday morning. And it was actually really cool. The children were little, and the dad would wake up early and go to a Saturday morning meeting. And when he would come home, he would stop and get donuts. And we worked with them for about a year. And one of their takeaways at the end of the year was that, like, these kids remembered the dad bringing them donuts, right? That's so simple and so powerful, because dad wasn't available all the other Saturdays because he was hungover, or maybe he didn't come home the night before, right? So those small things, that having gratitude that we talked about earlier, that's a good example of that. Creating healthy boundaries and sticking to them. I think we spent a lot of time talking about that, having boundaries and sticking with them. that second part's the hard part, right? Like, so really, if I'm going to set a boundary, and if I'm doing it effectively, the only person who can break that boundary is me, right? So, and this is also the hard part. I need to be able to stick with whatever I said I was going to do. So there's no sense in coming up with this, like, you're going to leave the house, or your stuff's going to be on the porch, or I'm not giving you any more money, if you're not able to do that, right? These things can be kind of come out of us when we're angry, or when we're sad, or when we're frustrated, but being able to keep those boundaries is so very important. Our patients are coming out of just chaos and dysfunction, and as are we. So boundaries help keep everything in like a box, right? Where everyone knows what to expect. Everyone knows what's coming. And it provides consistency and accountability and structure in a way that is so needed in the recovery process. So if you think of like a boundary is like wellness and recovery, chaos, no boundaries is like just total dysfunction, right? Educating yourself on substance use disorder. This one's so important. We don't know what we don't know, right? So like, why can't they just stop? you see all of the pain that is happening. The arguments, the tears, the fighting, like, can't you just stop? And the reality of it is, it's not that simple. So really being able to allow yourself to, like I mentioned earlier, whether it be the family education program, whether it be in some kind of counseling, there are specific counselors who are certified in addiction. So if you are needing family counseling of sorts or therapy, really getting with someone who knows enough about addiction to really help support you in this process. You know, sometimes we have patients come in and maybe one substance wasn't the issue, and it's just the idea of like, well, let's just make sure they don't use that substance. But then what we learn is they can't really use any substance successfully, right? But it's family like, well, I didn't know that they weren't allowed to drink. I thought it was just this, right? So I wasn't sure that I didn't know I wasn't supposed to, you know, fill in the blank. So, you know, knowledge is power. So really just being able to put yourself out there. I think the fact that all of you are on this Zoom call with us here now speaks to how open to this process you are and wanting to learn things. So as far as the Caron inpatient program with COVID, I believe, and Corey, I don't know if you can speak more to this. I know that there are sessions now that are occurring online that, like, similarly to this, that are happening. As far as the specific in person, I think that that's something that may be starting on the women's unit, but they're kind of like working on the logistics and all of that. I don't know, Corey, if you want to add.
I just know that it's taking some time given the current resurgence. So the plans that we had in place are probably not happening.
Changing a bit. Yeah. So Hamilton and Diane, again, certainly you can log on to this type of format. I know it's not the same as in person, but that this is certainly an option to do it that way as well. Thank you for asking that. Weekly family meeting with a loved one. I think that's one that sometimes doesn't get utilized as much as it could. I think that there's such an opportunity for healing to take place when the family sits down together. And one of the things that I would say when I facilitated the family program is the weekly meeting can't just be about the patient, because guess who's going to stop coming to the weekly meeting, right? So really being able to take a risk as a family to sit down and talk about, how am I doing? Like, how am I doing as the mom, the husband, the wife, the brother, the sister? And oftentimes there's other people in the home, right? So there could be other children. If you're adults, there could be children involved. So really creating this space each week that's like non-negotiable, where everybody gets to sit down and just check in, like, this is something I did for my recovery this week. This is something I'm going to do next week, or this is something I'm grateful for. So again, really just creating that forum for people to connect and to just check in with one another. All right. Lucia, do you want to read our last slide? And I'm aware of the time here.
Yes. So we end just with a quote that we liked, that focuses on taking care of ourselves. And that's the one thing that we know for certain, is if we focus on ourselves, that is one thing that we can change. Mm-hmm. I know that that we're kind of coming to the end here, and we have some questions. Maybe we can just take a couple minutes if there's anything else that's coming up. Let's see. In a similar situation as Veronica, seeing a lot of good thinking and positive thought process from my son. However, he just asked me to co-sign for an apartment. I want him to encourage and support little successes since he's had a lot of failures. Should I help him sign or say no? He has enough for rent, but don't want to enable. Okay. So he's making enough for the apartment. And do you feel comfortable co-signing for him? Like, what was your initial thought and how you wanted to handle it? This is Teresa. You're welcome, Judy. Thank you. Okay, you wanted to stay out of it. Okay. So I think it would be helpful again, if it sounds like maybe he's coming out of sober living and wanting to kind of transition to his own apartment. So if he is working with an aftercare program, or if he's working with clinical staff, I would encourage you to have some of this dialogue together with them. And I do think that you could be supportive of him moving on without necessarily having to participate financially in that. So if that's something that you wanted to stay out of and you wanted him to take on himself, and you not have a part in that, I think that is an okay boundary to set. Okay. And it is hard for them when they're young and they're sort of on that cusp of trying to put themselves out there, and trying to become more autonomous and independent, as we talked about. It is a difficult thing.
I think just on that note too, some of this stuff as parents, I think to validate and normalize, you may be dealing with regardless of if active addiction was present, right? So this may just complicate it. And I think really being able to do your own work and reflection of what are they doing? Like the reality of it is some of our patients are going to need help getting back on their feet, right? So really taking a look at, is there a boundary around that? I will help for 3 months and then I'm out. Or I will help for 6 months. I will give 1 month's rent and then I'm out. If the patient, and really, really being able to answer that for yourself of, do you like what you're seeing? Are you getting collateral information from other people that they seem on track? Are they doing the things that they agree that they would do? And if not, that could really change the answer, right? So I will support recovery. I will not enable this disease. And I think sometimes support it comes in the form of like, they're going to ask for these sorts of things to help get on track.
Mm-hmm.
Okay. I am aware of the time.
I was going to mention that Corey put a link there for feedback. If you're willing to take a moment to click on that and give feedback for future presentations, we would certainly welcome that.
Thank you all so much for your time this evening. We appreciate all of the participation, and it was really nice just having that. I think it's always helpful when we hear from people, and then it helps drive the conversation. So thank you, everybody.
Thank you, everyone.
Thank you, Laura and Lucia. Thank you, everyone, for participating.
Thank you.
Thank you, everyone.